is regulated by thyroid stimulating hormone. Okay, and the thyroid hormone is responsible for increasing the metabolism in every cell of the body. Thyroid hormone is responsible for increasing the metabolism just by increasing the oxygen consumption in every cell of the body. So, in which condition we will use these thyroid drugs? In hypothyroid states. The hypothyroid states in children, it is referred as cretinism, and in adults, it is referred as myxedema. And myxedema coma is a medical emergency condition. Okay, thyroid drugs are used to treat the hypothyroid states, and anti-thyroid drugs are used to treat the which condition?
Hypothyroid condition.
Hyperthyroid. Okay, and the symptoms of hyperthyroid states are decreased metabolism in every system of the body. Just see the clinical features of hyperthyroidism and hypothyroidism. In hypothyroidism, the BMR rate is increased. In hypothyroidism, the BMR rate is decreased. And coming to the cardiovascular system, in hyperthyroidism, the heart rate is increased, stroke volume is increased, cardiac output is increased. And coming to the hypothyroidism, heart rate, stroke volume, cardiac output is decreased. And in CNS, in hyperthyroidism, nervousness will occur, and in hypothyroidism, mental retardation will occur in cretinism. And coming to the GIT, appetite is increased. In hypothyroidism, appetite is decreased. Okay. And coming to the reproductive system, in hyperthyroidism, menstrual irregularities is there, and in hypothyroidism, infertility, impotence will be there. And these are the clinical features of difference between hyperthyroidism and hypothyroidism. Simply in hypothyroid states, decreases metabolism in every system of the body. Clear? And now we will see the thyroid hormone synthesis. How the thyroid hormones are synthesized? I think in first year you all read, right? Am I audible?
Yes, ma'am.
Am I audible?
Yes, ma'am.
Yes,
Yes,
madam.
ma'am.
Yes, ma'am.
Then tell me the synthesis of thyroid hormones. What are the steps takes place in the synthesis of thyroid hormones? Synthesis of thyroid hormones takes place by following steps. That is, first one, iodide trapping, oxidation, iodination, coupling. Do you remember or not? What is iodide trapping? Have you read in first year or not? Synthesis of thyroid hormones. ఏమన్నా చదివారా చదవలేదా? అది చదివితే చదివానని చెప్పండి, లేకపోతే లేదని చెప్పండి, లేదా గుర్తులేదని చెప్పండి, ఏదో ఒకటి చెప్పండి, రెస్పాండ్ అవ్వండి.
గుర్తులేదు మ్యామ్.
కనీసం వినిపిస్తుందా? నా వాయిస్ వినిపిస్తుందా? రెస్పాండ్ అవుతారా? ఉం? సరే, పిక్చర్ కనిపిస్తుందా మీకు?
ఎస్ మ్యామ్.
ఉం? సరే. So synthesis of thyroid hormones takes place by three steps. First one is the iodide trapping. Next one is the oxidation and iodination. Next one is a coupling. First, what is iodide trapping? See, active transport of iodide ions into the follicular cells. See, from the plasma. See, from the plasma, iodide ions actively transported into the thyroid follicular cell. Heading is there, thyroid follicular cell. This region is a thyroid follicular cell. Okay, so iodide ions actively transported from plasma into the thyroid follicular cell. This is called iodide trapping. Clear?
ఎస్ మ్యామ్.
So this is the first step. This is called iodide trapping. Active transport of iodide ions into the follicular cells of thyroid gland is known as iodide trapping. Next, iodide ion is oxidized to iodine by peroxidase enzyme. Second step. Second, two number is there, right? That is second step. Iodide ion is oxidized to iodine by peroxidase enzyme. This is called oxidation. Clear?
ఎస్ మ్యామ్.
Next, C plus is there, right? This iodine combines with tyrosine residues of thyroglobulin molecule. Tyrosine residues of thyroglobulin molecule in a colloid. This is colloid region, okay? And forms monoiodotyrosine and diiodotyrosine. Iodine combines with tyrosine residues of thyroglobulin molecule in colloid and forms monoiodotyrosine MIT and diiodotyrosine DIT in colloid. Okay, this is called iodination. Up to here clear?
ఎస్ మ్యామ్.
Yes, ma'am. This is called iodination. Okay, next, coupling. This is the final step in the synthesis of thyroid hormones. Two molecules of DIT. DIT plus DIT leads to the formation of T4. One molecule of MIT combines with the one molecule of DIT leads to the formation of T3. Okay? Two molecules of DIT couples to form T4 and one molecule of MIT combines with the one molecule of DIT forms T3. Clear? This is called coupling. So this is about the synthesis of thyroid hormones. Clear? First one, iodide trapping, oxidation, iodination, and coupling. After coupling, next step is hormone release. And this hormone release is under the control of thyroid stimulating hormone. Okay? T3 and T4 is released into the plasma. But most of the hormone released from thyroid is T4. But T4 is less potent than T3. Remember that point. T4 is less potent than T3. So peripherally, T4 is converted into T3. Peripheral conversion is there. T4 is converted into T3. That is deiodination by the enzyme deiodinase. T4 is converted into T3 by the enzyme deiodinase because T4 is less potent than T3. Clear? This is about synthesis, storage, and release and peripheral conversion of T4 to T3 of thyroid hormones. What is iodide trapping?
Active transport of iodide into thyroid follicular cells.
Very good. What is oxidation?
Iodide conversion into
Iodide is
iodine.
converted to iodine.
Iodide oxidized iodine by peroxidase enzyme.
Very good. Iodination?
Iodinum combines with tyrosine, forms monoiodotyrosine diiodotyrosine.
Very good. Coupling?
Two molecules of diiodothyronine forms T4. One molecule of monoiodotyrosine plus one molecule of diiodothyronine forms T3.
Very good. Peripheral conversion of T4 to T3?
Iodination.
Deiodination.
Deiodinase. T4 is less potent than T3. Up to here clear?
Yes, ma'am.
So this is about the synthesis of thyroid hormones. Synthesis of thyroid hormones takes place by iodide trapping, oxidation, iodination, and coupling. What are the clinical features of hypothyroidism? Simple.
Decreased PMR rate,
Hmm.
decreased heart rate, stroke volume, and
Hmm.
cardiac output, mental retardation in case of cretinism,
Hmm.
fertility,
Hmm.
appetite decreases.
Hmm. Very simple. In every system, all metabolisms is decreased. Okay. In hypothyroidism state. So next, after release, how it acts, mechanism. So these hormones combines with the nuclear receptors and activates the different genes and synthesis various proteins and produces different effects. Simple. just combines with the nuclear receptors, just like a steroid hormones. These hormones also combines with the nuclear receptors and activates the different genes and synthesis the various proteins and produces the different effects. Okay, so in which condition we will use these preparations, T3 and T4 preparations? The available preparations are levothyroxine and leothyronine. Levothyroxine sodium is T4 and leothyronine is T3 preparation. Okay, so in which condition we will use these preparations? T3, T4, thyroid hormones. In which condition we will use? These are not
Hypothyroidism.
anti-thyroid drugs. Not anti-thyroid drugs. Thyroid preparations.
Hi.
Thyroid hormone preparations.
చెప్పండమ్మా.
Hypothyroidism, ma'am.
Very good. Just as a replacement therapy. In hypothyroid state, there is a deficiency in synthesis of thyroid hormones. That's why we are replacing. Just as a replacement therapy, we are administering these preparations. The available preparations are levothyroxine, sorry, levothyroxine sodium T4 and leothyronine T3. Okay, these two preparations are available. Levothyroxine sodium available as a tablet and parenteral preparation, and leothyronine is also available as a oral tablets and parenteral preparation. And these drugs are used to treat the cretinism, myxedema and myxedema coma. Okay, this is about thyroid drugs preparations and hypothyroid state. Clear? Next, coming to the anti-thyroid drugs. These drugs reduce the level of thyroid hormones by reducing thyroid hormone synthesis or release or both. They are used in the treatment of hyperthyroid condition or thyrotoxicosis. Coming to the drugs are classified into thyroid hormone synthesis, thyroid capping, thyroid and others.
Ma'am, your voice is not audible.
No?
Your voice is not audible, ma'am.
Am I audible?
Yes,
Yes,
ma'am.
madam.
Yes, ma'am. పవర్ పాయింట్ కనిపిస్తుందా?
Yes, madam.
Yes, ma'am. So come to the classification. The thyroid hormone synthesis inhibitors are propyl thiouracil, methimazole, carbimazole. And next, inhibitors of iodide trapping, thiocyanate. First group of drugs, thioamides, propyl thiouracil, methimazole, carbimazole. So these are thyroid hormone synthesis inhibitors. How these drugs inhibit thyroid hormone synthesis? They inhibit thyroid peroxidase enzyme. So peroxidase enzyme is responsible for how it acts?
Oxidation.
Oxidation, which converts iodide to iodine, right?
Iodine.
So these drugs inhibits peroxidase enzyme and prevents oxidation and thereby inhibits the synthesis of thyroid hormones. Okay. Next, they inhibit iodination of tyrosine residues in thyroglobulin. Okay. And next one, they inhibit coupling of iodotyrosine, MIT and DIT. And they also inhibit the peripheral deiodination of T4 to T3. Means these drugs inhibit deiodinase enzyme and inhibits the peripheral conversion of T4 to T3. Clear? So these drugs, thioamides, inhibit oxidation. Next, iodination. Next, coupling. Next, deiodination. Right? By blocking all these steps, these drugs inhibit the thyroid hormone synthesis. Next, pharmacokinetics. Thioamides are well absorbed orally and they are widely distributed and get accumulated in the thyroid gland and they are excreted in urine. And important features of propyl thiouracil, these are less potent and highly bound to plasma proteins. 90% of drug binds to the plasma proteins and short half-life and the duration of action 4 to 8 hours. And these drugs inhibit peripheral conversion of T4 to T3 passage across the placenta is low, and levels in breast milk is low, and highly plasma protein binding. 90% binds to the plasma protein. That's why it is safe to administer in pregnant women. And coming to the therapeutic uses, it is used for long-term treatment of thyrotoxicosis, and along with radioactive iodine to hasten recovery in thyrotoxicosis, we use propyl thiouracil, and along with iodide and propranolol, and coming to the adverse effects, skin rashes, joint pain, fever, hepatitis, nephritis. The most dangerous but rare adverse effect with this group of drugs is agranulocytosis. In this group, two more drugs is there, that is methimazole and carbimazole, right? Carbimazole is a prodrug. It is converted into methimazole, and these drugs are not safe to administer in pregnant women. Plasma protein binding is very less, only 10%. It crosses the placental barrier. If we administer to the pregnant woman, it causes fetal hypothyroidism. It causes fetal hypothyroidism with neurological and bone abnormalities. This is the difference between propyl thiouracil and methimazole and carbimazole. These two drugs are not safe in pregnancy, causes fetal hypothyroidism with neurological and bone abnormalities. Clear about thioamides? These are thyroid hormone synthesis inhibitors. These drugs inhibit peroxidase enzyme, iodination, coupling, and peripheral deiodinase inhibitors. Okay? Propyl thiouracil is safe in pregnancy, and remaining two drugs not safe in pregnancy. Causes fetal hypothyroidism. Propyl thiouracil having high plasma protein binding, and remaining drugs having less plasma protein binding. And coming to the adverse effects, skin rashes and agranulocytosis is rare. Clear?
Yes, ma'am.
So this is about thioamides. Next, radioactive iodine. 4 marks question. Radioactive iodine is a 4 marks question.
Madam, PPT is not visible, madam.
Therapeutically, కనిపిస్తుందమ్మా?
Yes, madam.
Next, next is the radioactive iodine. Practically used
Ma'am, not audible.
and iodine 123 is used for diagnostic scans.
Yes, ma'am.
Am I audible?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
PPT కనిపిస్తుందా? అమ్మ పీపీటీ కనిపిస్తుందా?
Yes,
Yes.
Yes, madam.
yes, ma'am.
Yes, ma'am.
So coming to the mechanism of action of radioactive iodine, these drugs concentrated in the thyroid and emits gamma rays and beta particles and destructs the follicular cells. It emits gamma rays and beta particles. The beta particles cause destruction of the follicular cells. That's why these drugs comes under thyroid tissue destroying agents. These drugs destructs the follicular cells, leading to fibrosis, and it corrects the hyperthyroid state. And the preparation available as a solution or capsule. And these preparations are used to treat hyperthyroidism due to adenoma or carcinoma when surgery is not feasible or contraindicated. When surgery is not feasible or contraindicated. And these drugs emit gamma rays and beta particles. So it is contraindicated in pregnancy, children, and nursing mother. And these drugs are available as a solution or capsules. That's why the treatment is simple and convenient. It can be given on outpatient basis. No need to administer in the hospital. And the treatment is inexpensive. It is not surgery, so no risk of surgery and scar. And it permanently cures hyperthyroidism. It permanently cures hyperthyroidism. This is the advantages of radioactive iodine. Coming to the disadvantages, slow acting and high incidence of hypothyroidism because it destructs the follicular cells and not suitable for pregnant women, children, and young patients. And it causes local soreness in the leg. These are the advantages and disadvantages of radioactive iodine. And coming to the remaining group of drugs, that is inhibitors of iodide trapping. So these drugs inhibits iodide uptake. The drugs are thiocyanates and perchlorates. These are highly toxic drugs and the effects are unpredictable. Nowadays, the use is declined. Next group of drugs, hormone release inhibitors. Actually, these drugs act at all steps in the synthesis of thyroid hormones, but major effect in the inhibition of release of thyroid hormones. Remember that point. Inhibits almost all steps in the synthesis of thyroid hormones, but major effect in the inhibition of release of thyroid hormones. And this group of drugs are oldest agents. Oldest agents used to treat the hyperthyroidism. Iodine and iodates are the oldest agents used to treat the hyperthyroidism. Okay, and the preparations are Lugol's iodine. It is 5% iodine in 10% potassium iodide. 5% iodine in 10% potassium iodide. And iodine and iodates are used as an antiseptic, as an expectorant. And coming to the adverse effects, these drugs causes allergic reactions. And next group of drugs, that is beta blockers, propranolol, metoprolol, atenolol. These drugs produces a symptomatic relief in hyperthyroidism. Uh, the symptoms like tachycardia, palpitations, and tremors are there. So to produce the symptomatic relief, we will use beta blockers. Just these drugs produce a symptomatic relief. But propranolol has an inhibitory effect on peripheral conversion of T4 to T3. Next, write down one more condition, that is thyrotoxic crisis. 2 marks question. Thyrotoxic crisis. Thyrotoxic crisis. It is due to very high levels of circulating thyroid hormones. It is due to very high levels of circulating thyroid hormones. It is characterized by hyperpyrexia, arrhythmia, nausea, hyperpyrexia, arrhythmia, nausea, vomiting, diarrhea. It is precipitated by infection, trauma, surgery. treatment. First point, we have to hospitalize the patient. Next, supportive measures. Second point, supportive measures. Next, drug therapy. Drug therapy. This condition is treated with propylthiouracil, iodides, iodides, propranolol, propranolol, hydrocortisone. My 2 marks question number. Treatment for thyrotoxic crisis. It is an emergency condition. Okay. First, we have to hospitalize the patient, and immediately we have to supply the supportive measures. Next, we'll go for drug therapy. That is, we'll treat with the anti-thyroid drugs like propylthiouracil, iodides, propranolol, and hydrocortisone. Clear?
Yes, ma'am.
Madam,
Yes, ma'am.
So this is about thyroid and anti-thyroid drugs. So in which condition we will use thyroid drugs?
Hyperthyroidism.
thyroid,
Hypothyroid condition. Anti-thyroid drugs?
hyperthyroid,
Hypothyroidism. So what are the steps comes under synthesis of thyroid hormones?
iodide trapping,
Very good.
oxidation,
Oxidation,
Very good.
coupling,
coupling,
Oxidation and iodination. Next, coupling.
coupling,
What is iodine
deiodination.
trapping?
Active transport of iodide to thyroid follicular cells.
Very good. Oxidation.
Conversion of iodide.
Conversion of iodine to
iodide, oxidate iodinum by peroxidase enzyme.
Very good. Iodination.
converts to the monoiodothyronine to the diiodothyronine.
Why T4 is converted into T3?
It is less
T4
potent.
is less potent than T3.
Less potent than 3,3.
Very good. What is the mechanism of action of these hormones? Binds with the nuclear
Nuclear
receptors.
receptors and activates genes.
Very good.
Synthesis of various proteins.
Very good. Produces the effects.
Produces the various
So what are
effects.
the thyroid hormone preparations?
Levothyroxine.
Levothyroxine,
Levothyroxine.
levothyroxine sodium, levothyronine,
Levothyroxine sodium and liothyronine. LIOTHYRONINA. Okay. Levothyroxine sodium T4 preparation and liothyronine T3. So these two are used as a replacement therapy in hypothyroid states. Okay. Attend your roll calls. While attending roll calls, switch on the cam. Roll number 1,
Present.
2,
Present, ma'am.
Present, ma'am.
Fourth, మా ప్రజ్ఞశ్రీ మీరు క్యామ్ ఆన్ చేయలేదు.
Ma'am.
5,
Present, ma'am.
6,
Present, ma'am.
7,
Present, ma'am.
8,
Present, ma'am.
9,
Present, ma'am.
10,
Present, ma'am.
11,
Present, ma'am.
12,
Present, ma'am.
13,
Present, ma'am.
14,
Present, ma'am.
15,
Present, ma'am.
16,
Present, ma'am.
17,
Present, ma'am.
17,
Present, ma'am.
18,
Present, ma'am.
19,
Present, ma'am.
20,
Present, ma'am.
21,
Present, ma'am.
22,
Present, ma'am.
23,
ma'am.
24,
Present, ma'am.
25,
Present, ma'am.
26,
Present, ma'am.
27,
Present, ma'am.
27, 28,
57.
Present, ma'am.
29,
29, present, ma'am.
30, 30,
30, present. 30, present, ma'am.
31,
Present, ma'am.
32,
Present, ma'am.
33,
Present, ma'am.
34,
Present, ma'am.
35,
Present, ma'am.
36,
Present, ma'am.
37,
Present, ma'am.
38,
Present, ma'am.
39,
Present, ma'am.
40,
Present, ma'am.
41,
Present, ma'am.
42,
Present, ma'am.
42,
Present, ma'am.
43,
Present, ma'am.
44,
Present, ma'am.
45, 46,
Present, ma'am.
47,
Present, ma'am.
48,
Present, ma'am.
49,
Present, ma'am.
50,
Present, ma'am.
51,
Present, ma'am.
52,
Present, ma'am.
53,
Present, ma'am.
54,
Present, ma'am.
55,
Present, ma'am.
56,
Present, ma'am.
57,
Present, ma'am.
57,
Present, ma'am.
58,
Present, ma'am.
59,
Present, ma'am.
60,
Present, ma'am.
61,
Present, ma'am.
62,
Present, ma'am.
63,
Present, ma'am.
63,
Present, ma'am.
64,
Present, ma'am.
65,
Present, ma'am.
66,
Present, ma'am.
67,
Present, ma'am.
68,
Present, ma'am.
69,
Present, ma'am.
70,
Present, ma'am.
71,
Present, ma'am.
72,
Present, ma'am.
72.
Present, ma'am.
मैं 72 मेरे क्या
Present, ma'am.
73,
Present, ma'am.
74,
Present, ma'am.
okay ma, thank you.
Thank you.
Thank you, ma'am.
Thank you, madam.
Thank you, ma'am.